I'm Shelley Weber Tompkins, and today I wanted to talk to you a little bit more about male infertility factors and how you can do something about it. Actually, first, how to test for it. If you're trying to suss out why you're not getting pregnant yet, then getting your partner or husband in to go get seen by their doctor is really important. And so, some of the things that you want to keep in mind is that sperm concentrations have been going down over the years. That's one area. Also, the motility itself, because it needs to be able to get to its location, and so motility is important. And of course, so is concentration. But also, having abnormally shaped sperm, like too many of those showing up in a sperm analysis, isn't good either. And so once you have it tested and know what's going on, then things can be adjusted in the lifestyle. And so some of the things that are actually factors that affect male sperm are things such as environmental pollution. And so this could be in their work environment, but it can just be going out in life. Like if you're close to areas or if their work environment is a little bit more toxic with substances and stuff around, or a lot of scent in the air, or just their job itself, if they're on construction sites or painting or other things of this nature, then they may need to mask or do some things to try and help lessen that impact. Smoking and drinking are ones that it's not forever, but at least doing it during the time frame when you're trying to boost up your sperm. It's better, I would say, to not do them anymore, but sometimes people don't want to do it, stop completely. And so, but if you can stop for at least the time to get another good sperm testing done, where you can see that everything's really viable, you have a good amount of sperm count, you don't have any irregularities, or actually everyone's got some irregularities, but you don't have that many. And then it's going to look much better for supporting fertility. All right. Exposure, as I mentioned about exposure to environmental pollution, pesticides is another one. So limit any spraying that you do around your own home. But also, if you see that people are spraying, try and avoid that area until the air can kind of help break it up a little bit, disseminate it. Sugar imbalances are another one that affect both of us. And some of these things I'm talking about here affect both men and women. So you both want to be mindful. But with sugar imbalances, it really can throw off your adrenal glands, which are also a big part of what help make hormones. And so lessening stress levels as well as working on lowering your sugar intake. So processed foods, they put sugar in everything these days. So if you're shopping from the inner aisles, you need to start gravitating to the outer aisles where you can get more of your fresh produce and your vegetables, your fruits. And then if you do find out with blood work that you have a blood sugar imbalance where your hemoglobin A1C is starting to direct you towards insulin resistance, and if you have family history with diabetes especially, you want to be mindful of your blood sugar. So you start trying to lessen anything, because if you're seeing it in your canned goods, if you're a label reader, you'll notice it there. And so you really want to make sure that you're minimizing that sugar intake as much as possible. The other thing that happens, I have other things or other YouTubes about fatty liver. So even if you don't drink, you can get fatty liver, because if you have too much sugar in your diet or things that turn to sugar, it gets dumped into your liver. And if the liver can't do anything about it, it keeps getting dumped more and more, then it can turn to fatty liver, which really makes processing things much more difficult. And then if it goes further than that, it can actually make you really have some liver problems down the line. So a lot of people only think that fatty liver happens from alcohol, but it doesn't. Sugar products are a big factor. So minimizing those two, especially if you're finding that your fasting glucose and your hemoglobin A1C are both elevated. Varicocele is another one that a lot of people don't know about, but for men, a varicocele is actually it's like having a varicose vein. It is having a varicose vein in the testes. And so it could be in one or both. But what happens is usually that comes with people that have to sit a lot, like could be job related, could be sitting all day in front of a computer, but it could also be you're a truck driver, you're on the road all the time, you're driving all the time. And so those things put more pressure on that area. And so it could lead to clotting factor or just getting that varicosity there. And so the important thing about that is when you have a varicose vein there, it warms up the area. And the very reason they tell you not to do hot tubs or get too warm there, or have your laptop sitting on your lap, is that's an area you don't want to get warmed up because it can impact the sperm. And so that's something to kind of keep in mind. So if you're sitting all day, try and do a standing desk more often. And if you're driving all the time, if you can do something that kind of takes the weight off the impact there on your on the testicular region, that's also good. All right. So next up, so checking your fertility. I mentioned, I don't know if I already mentioned this, but Kruger testing. That's Krueger. That test is the best one for checking on sperm because it gets into a lot more detail. It's a little more, it looks at things a little bit differently for what the best ranges are. And that one is one I suggest highly, is making sure you're getting a strict Kruger test done for your partner. Genetic sperm testing is another one that I suggest. Not everybody does it, but if you've been trying for years now with no success and you know you don't have fibroids or endometriosis or PCOS or any other factor that could be impacting you as a female, then male factor wise, you want to take a look and make sure there's not a genetic factor that could be getting in the way. Sometimes that happens in the sperm. It's not just a regular genetic test for the blood. This is specifically sperm. And so if you're looking at that, you can see and make sure that there's nothing that might be limiting things. If you're in the IVF process already, them knowing that information can change up how they go about, or I should say what they use medication-wise in the process. So, or actually even like what they take when they pick an embryo, that they can be much more selective and make sure that if they know there's a translocation or some problem in the genetics, they might be able to find one that doesn't have that and put that, use one for the IVF. Okay, otherwise, blood and hormone testing, both of you should have that. But at least tell you, like, is there liver problems? Are there blood sugar problems? Is there anything like, is the fibrinogen or clotting factors, more of an issue? So that if you know what's happening, it's easier to take steps to fix them. Otherwise, so steps to improve, like having a healthy weight. So if you're not exercising at all and you feel like you're kind of need to get a little bit more movement in, even if you're doing like 10 and 20 minutes a day, if you have a dog and you're taking it for a walk, or you just take yourself for a walk and get a little brisk movement going, it could be 10 minutes one way, 10 minutes back. Or if you have exercise equipment at home, just try and make sure you're getting some time in where you're getting good movement. Lymphatics don't move themselves. And so you have to do the movement or get lymphatic massage, but it's the detox vehicle of our body. So we want to make sure we're doing things to get that taken care of. Also making sure that you're getting in healthy diet. So I talked about already, moving in moving out from the inner aisles to get more organic produce. There is Environmental Working Group has a chart that they can send to you, and it has the clean 15 and the dirty dozen. Dirty dozen are the most pesticided of vegetables and fruits. So they're ones that you definitely want to avoid unless you're buying them organic. The clean 15 are ones that you can get away with without necessarily having to buy organic. That list changes every year. So, next year you want to check it again. Usually strawberries is always very highly pesticided. So if you're not buying that organic, you should be. Okay. Otherwise, good sleep, super important. If you're always waking up feeling tired, you may want to make sure that you don't have other factors that are getting in the way. Your blood sugar is not a problem, but also that you don't have apnea. That seems to be happening more and more for people where they're not getting into deep sleep and they keep getting woken up because they're not getting oxygen, so their body triggers that. And so if that's the case, you want to be able to do something. And there's some other things these days besides getting CPAP machines, but it's important that you're getting good oxygenation to help the rest of your body function well. All right. And I already mentioned getting some regular exercise. So those are some of the things I think are really good to be mindful of, and making sure that your partner's getting in for the good testing. Like I said, if you've been trying for a while, get the genetic testing done too for the sperm, just to rule it out. And then make sure that you're keeping your life, your environment clean. You can also get investing in a good air filter at home can be really good. And look through your products, your cleaning products, things that you use on the skin, and make sure you're keeping those as clean as possible, that they don't have a lot of chemicals in them that you're putting right on your skin and it's getting absorbed. Okay, so I will be giving you more information on both male factor and female factor. So stay tuned and please subscribe. Thank you.